Hello, my name is Rochi. I'm here to do a remediation video for you today regarding my central line dressing skills video for you. So the first thing I want to do, I'm going to perform the sterile portion of the procedure. So the first thing, I'm going to want to perform hand hygiene. After I perform hand hygiene, I'm going to want to get my central line dressing change kit ready. So I'm going to open it. As I open it, I'm going to want to open the cover away from me. And then I'm going to pinch the corner so that way the cover doesn't flop over on me as I do the procedure. The next thing I'm going to do, I'm going to put on my sterile gloves. So I'll take my sterile gloves here. You're going to want to open this, making sure to only touch the 1-inch border. So the next thing, I'm going to don my sterile gloves. I'm going to want to put on me I want to dress my non-dominant hand first. So with my dominant hand, I'm going to pinch the glove. And as I put this glove, I want to make sure I'm putting it away from the field here. So that way, in case I don't accidentally drop it. Okay, so now that I have my left one on, or my non-dominant, I'm going to now to dress my dominant hand. So with my non-dominant hand, I'm going to want to scoop underneath here. And then I'm going to put on my dominant hand here. Okay. Now that I have both gloves on, I'm going to want to make sure not to touch below my waist or not touch anything that is non-sterile. That way I can keep sterility, so making sure not to do that. So now I'm going to be cleaning my central line as well as the area around the central line. So I'm going to be using a chlorhexidine swab, which I will crack open and make sure it's fully saturated before I do any kind of cleaning. I'm also going to have a sterile gauze to hold the distal end of the central line as I clean it. So I'll get my gauze. I'm going to grab the distal end of the line, and then I have my chlorhexidine swab. So after I crack it, I'm going to want to make sure that it is fully saturated before I proceed in cleaning. As I clean, since this is chlorhexidine, I'm going to want to go in a back and forth motion on all four sides for 30 seconds. However, if this was a alcohol, we'd be doing it in a circular motion for 30 seconds. So now I'm going to want to clean the area, and the area which I will clean will be about the size of the new dressing that I'll be using. So I'm going to do this for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after cleaning the area for 30 seconds, I'm going to now clean the underside of the central line. And this is to ensure that if I accidentally drop the line here on the patient's skin, it won't be contaminated and will remain clean. And after doing the underside, I'm going to want to do the top portion now. After cleaning there, I'm going to sit it down. I'm going to dispose of my gauze in the trash. I will then dispose of my chlorhexidine. The next thing we're going to do, I'm going to now make sure that the area is completely dry. Depending on how saturated the area is on the skin, it will be, of course, take longer. So let's just say that this is completely dry now. So I'm going to be putting on a new Tegaderm, but since I don't have any Tegaderm, I'm going to simulate that by using a bandage on the patient. So I'm going to take my new dressing. I'm going to open it. Now normally the Tegaderm would have a border around it, which I would peel around, and there would be a label on it. And then as I put it on, I would want to make sure that there's no wrinkles, and I would want to make sure it was secure over the site. Okay, so I want to make sure this is completely secure, and I simulated having a label here. So my pen, I will put the initial date and time, and then I will make sure to put it on the side of the skin. I will not put it over the dressing. It should be to the side. So after that, I'm going to now clean up my area. I will discard that in the trash. I'll also discard my pen. I will next get rid of my gloves. Discard that in the trash. I'll perform hand hygiene. I will then take off my mask, dispose of that. I will take off the patient's mask. I will perform hand hygiene again. I will then make sure the bed is in a low position, make sure my patient is comfortable, make sure my patient is safe, ask my patient if they need anything. Mr. Smith said he's okay, he doesn't need anything. So then I will, after that, I will leave the room and I will document the procedure and what I've done, and that is all.